We are going to do hip distraction flexion mobilization, which is somewhat challenging with the spasticity, but when we started, he had about 90 degrees of hip flexion. When he started, he only had about a pea-sized HO from ultrasound, and I collaborated and I sent him to the doctor next door to do an ultrasound. He put him on some HO medication to help decrease the formation, but it still has formed. Now, I would say, was it like a golf ball size? Yeah. So, and this is where just, you know, as a PT in the state of Colorado, we can order imaging. So we ordered an MRI because after about 2 months, he's getting better. Everything I was working on, muscles, fascia, spasticity, better. But his hip was just not getting better. So I really want to see what was going on in there. And he has an avulsion fracture of his rectus femoris and iliopsoas, I believe, and so that has caused, and that was probably from his original stretching injury, more HO to form. So we are just trying to mobilize. He felt very limited at 90, now it's about up to 115. So I do a hip distraction mobilization, which you guys probably learned. But it's a little different with the spastic leg. So I'm just pulling, usually I just start and I just do some mobilizations with movement out to the side this way. Just trying to go slow. And then I'll do, so now he's getting spasticity in his adductor and hamstring, which kind of fight me. So I have to do a little bit of slow rocking, and you can see like his other leg will pull up with his adductor firing sometimes. So we just go slow. I can feel the bone on bone when I get there, and he doesn't feel pain as much, so I'm just kind of careful like how hard I crank on it. But it's just very slow, whereas like a patient without spasticity, you can just kind of take them where you want to take them a little bit quicker. So it's usually a bit of a workout. So I need a lot of tone resistance too. There's a little bit more tone today, I feel like. Right there, I feel like probably some bone on bone. So I don't try to push that too hard. We do want to try to break up some of that as much as we can. So, but I just need him in a functional hip range of motion. You know, from a chair, getting in and out of the car. But he's an athlete, so he likes to get a little bit more hip range of motion than we got here. So. So that is hip distraction mobilization with spasticity. So it's definitely very slow, and I usually do it for a little bit longer, but I'm going to turn the video off and do a little bit more. Thanks.